I'm Dr. Bill Cofer. I'm a general dentist in Greer, South Carolina. I've been practicing here 39 years, and I met the most wonderful person, Dr. Rosenberg, who had done some surgery for some of my friends and some of my patients. He was a very understanding and wonderful guy, understood my problem, and was patient with me to understand that I really wanted to take the time to do it right and to lose the weight so I'd be a good surgical risk for him. For almost 2.5 or 3 years, I got in progressively more pain, where it hurt so much to walk that I stopped doing a lot of the things that I enjoyed doing. Even though I wanted to, I didn't feel like doing them, so I just kind of started, my circle got very small. If you think of like taking a piece of paper and making the biggest circle on that paper you could make, as my hips got worse and my pain got worse, my circle got smaller. And when I came in to have my first hip replaced, my circle was a dot. The anterior approach, like Dr. Rosenberg does, from a standpoint of a surgical entry, does not cut through any muscle tissue. It cuts through skin, cutaneous tissue, and then you're right at the joint itself. Physical therapists that I've spoken to are very high on the frontal approach from a standpoint of so much less tissue damage because you don't cut through muscle. And also the rehab time for most people is cut in half. The average rehab time for conventional hip surgery is right at 6 weeks. And as I said, I was fortunate enough to be able to come back both times a day short of 3 weeks. So my total rehab time, my total time out of my office for both hips was less than the amount of time that most people rehab for one hip. The first moment I walked into St. Luke's Hospital, I felt like I had gone back in time to the same feeling I had as a young man walking into our little regional hospital. Everybody is so nice, so friendly, so caring, so personable. From the front office where you have the receptionist area, all the way back to everybody on the staff.